Okay. So, anxiety disorder is probably not surprising. The thing that they all have in common is that the person has a very intense anxiety or fear. And there are a few different anxiety disorders. They all have very similar symptoms. It's really just about like what stimulus or trigger those symptoms are targeted towards. Anxiety disorders are also very comorbid with a lot of other disorders. So we've already seen that. Pretty much any time I talk about comorbidities, anxiety disorders is going to often be one of the common ones. There are some pretty effective medications and therapies for treating anxiety disorders. So unlike the neurocognitive disorders, we do have quite a few treatment options that seem to be fairly effective. So again, there are several different types of anxiety disorders. And again, all of these, the main difference between them is just what the anxiety is triggered by or, towards. Generalized anxiety disorder, as the name implies, is where someone has constant anxiety and worry over a wide range of issues. So they pretty much feel anxiety, very frequently, and there's not a specific thing that's really triggering it. For someone to be diagnosed with generalized anxiety disorder, they basically have to have, I would say, like more bad days than good days over a 6-month period. So within a 6-month period, if you counted all those days that they're having severe anxiety, and that's more than the days that they're not having severe anxiety, then they would be diagnosed with this generalized anxiety disorder. So they have to have that kind of excessive anxiety and worry, like the psychological component. And then in addition to be diagnosed, they have to have 3 or more kind of physiological symptoms. So that could be things like restlessness. They might constantly pace or I have a brother with anxiety who's just constantly like moving his knee up and down if he's sitting, can't sit still. They may have fatigue. They may have difficulty concentrating, irritability, muscle tension, or problems sleeping. So if they have the anxiety and worry over a 6-month period plus any of 3 of those symptoms I just named, then they could be diagnosed with generalized anxiety disorder. Specific phobia is having an irrational, disproportionate fear towards a specific object or stimulus or situation. Some of the most common phobias are towards animals, things like sharks, bears, spiders, snakes, etc. Also situational phobias, so that would be things like being in an elevator or an enclosed space, being in an airplane. Environmental factors, so some people have phobias of like storms or heights. What else? Those are the main ones I can think of. Oh, things like needles, medical procedures. Those are other common phobias. So to be diagnosed with it, the person has to have a fear to the point that they actively avoid whatever that stimulus is. And again, it has to last for at least 6 months. So just like with generalized anxiety disorder, I think pretty much with all of these, kind of the cutoff time-wise is going to be at least 6 months of experiencing the fear or anxiety. But like I said, avoidance of the trigger is one of the main kind of criteria for diagnosing specific phobia. Agoraphobia, it's kind of like a specific phobia, but it's a little more broad than that, I think is why it's kind of put in its own category. So agoraphobia, typically people with this have a fear in general of just like being in public spaces. They might specifically be really scared of using public transportation, like buses and airplanes. They might be scared of really wide open places, like being in a parking lot or a park, or being in public places like stores, malls, movie theaters, anything like that. They also might have a fear of just leaving the house in general. So people with really extreme agoraphobia will do everything that they can to stay in their house for as long as possible and not leave, especially not alone. So someone with agoraphobia might be a little more comfortable if they can leave the house with like a family member or a friend, but they're very, very terrified, especially of going out in places by themselves. Social anxiety disorder is fear and anxiety caused by social situations. So someone with social anxiety disorder, they often specifically are scared of being judged negatively by others. So they might avoid like parties or other social situations because they worry that the people around them are going to think that they're boring or they're stupid or they're, whatever, some sort of negative thing. They also often tend to have this kind of like cyclical anxiety where it's like they're anxious about a social setting And then when they go to a social setting, because they're anxious, they might act awkwardly. And so then that social interaction maybe doesn't go so well because they're acting awkward. And then that just escalates their anxiety, and it gets into like this cyclical thing that can be kind of difficult to like shut down. Panic disorder is not necessarily triggered by a specific event the way that these other anxiety disorders are, but it's basically where someone has a series of recurring panic attacks. So during a panic attack, basically someone feels this kind of sense of impending doom. They have a fear that's not really targeted at anything specific. They just feel suddenly like afraid and overwhelmed. They may have a fear that they are dying. And often someone with a panic attack will have accompanying physiological symptoms. So their heart rate might increase, their breathing rate might go up, they might be sweating. They also sometimes might have like pain in areas of their body. They might have nausea, dizziness, like tingling or numbness in their limbs. Usually the panic attack is very short. It might last like 10 minutes or less, but to the person having the panic attack, that can feel like much longer. So someone with panic disorder, they have those panic attacks recurring multiple times over the course of, a long time period. Can't remember, I didn't see any like specific numbers for you have to have this many panic attacks over this amount of time to be diagnosed with panic disorder. I think it's just that they're recurring, basically.
Could I ask?
Yeah.
Are the panic attacks like similar to like a seizure?
I would say no. It'd be most people that are having a panic attack, like you could probably tell visibly. It just depends. Like some people might have a panic attack in a public setting and they might be able to kind of contain it and no one even knows that it's happening. But if someone is having a panic attack and showing symptoms, like they might just be breathing heavily. They might be, some of those like restless movements, moving their leg around, things like that. But no, it wouldn't look like a seizure. Yeah.
Like, it's more of like an inner body experience. It's like, they say like it's like they feel like someone's compressing like
Yes.
their breathing airway and like, so that's something that more on their inside it.
Yeah.
I have
Yeah,
panic
it's
disorder, and it's definitely more than just the inside to me because I find myself pacing back and forth.
Right.
I can't stop. I think I'm going to die. It's a terrible, horrible feeling.
Yeah.
And like you said, your heart rate is going. And what do you do? I just apologize to my friends, like, sorry.
Yeah. I think it depends on the individual and also the where it's happening, right? Like I've known people I've had a couple of panic attacks. It's never been like panic disorder. And my brother, again, probably could be diagnosed with panic disorder. He's never seen anyone professionally that has panic attacks. And he typically, it depends. Like I've seen him in a space where it's just like we're at home and then he'll get up and pace around and do all that. But then there's been other times where we've been in a more public setting and he's able to just, like, I can tell he's having a panic attack, but that's because I've seen it. So he might, he'll often start, just rubbing, he'll rub his thumb on his hand or on, his knees, and, his breathing escalates. But other people around probably don't even notice it's happening. So, yeah. Karen.
I've kind of had an increase in panic attacks over the last few years. But I had a super remarkable increase 2 days after I got the COVID shot.
Mm.
And I was tested for all sorts of things because I literally felt like I was having a heart attack.
Right.
And it lasted for over a week.
Yeah.
And I could not function. I couldn't do anything. And it kind of subsided. But now I have them more frequently, like 4 times a month,
Right.
as I used to. And I get honestly when it hurts when it bursts out of my chest.
Yeah.
I don't know if anybody really notices, but I
Yeah.
get pain coming through here. It literally feels like I'm having some sort of a heart attack.
Yeah.
Labs come back normal, EKG.
Right.
Everything.
Yeah, that's a common thing I've heard with panic attack is people often have this fear that they're dying while they're in it. And I mean, anytime I've experienced a panic attack, that was my first thought too, is am I having a heart attack? And that's often the feeling, but then yeah, people get tested and things and everything comes back normal. And I'm not really sure, my guess would be that what's happening during a panic attack is that you're just becoming hyper aware of everything that's happening in your body. It's like right now, your heart's beating, your lungs or whatever. And if you stop and just like really ruminate on that and think about it, it can start to get kind of like, you know, creepy a little bit to think about like what your body's doing. So I think when someone's having a panic attack, they get so internalized and so focused on every little movement of every part of their body that everything feels much more intense than it actually is. It feels like the heart is beating really hard. It feels like, because I've had a Fitbit for like 15 years or something, however long Fitbits have been around. There's been times in the past where I was having a panic attack and I'll even check my heart rate and it's like completely normal. But it feels to me like my heart is beating like, 200 beats per second or per minute or whatever. But it's like, no, it's like all psychological to some extent. So, yeah.
I feel like it's almost like my fight or flight
Yes.
is off.
Yes.
And so then what it is it's just a surge of hormones
Yeah.
or whatever.
Yeah, so we'll talk about causes in a second, and that's exactly one of them. That people with panic disorder, they have basically overactive, like norepinephrine, the adrenaline system, is just overactive. So it's like, yeah, that fight or flight response is just kicking in when it shouldn't be, when it doesn't make any sense for it to be kicking in. Yeah.
I want to say with my panic disorder, mine didn't start, it just started after I had a traumatic experience.
Mhm.
So I was fine my whole life, and then I had that traumatic experience.
Yes.
And then that is when I started having those panic attacks.
Yeah, yes, that's another fairly common thing that runs throughout. A lot of these even, it's like, someone might be fine and then some specific thing happens that causes all these anxieties or phobias, and same with panic disorder. Yeah. All right. Thank you all for sharing. So yeah, we'll talk about causes in just a second and probably circle back to some of those. So epidemiology, anxiety disorders are fairly common. So, I've got the numbers here. Generalized anxiety disorder, about 3%, 12-month prevalence. So if we polled people and asked everyone within the past year, have you been diagnosed with generalized anxiety disorder? About 3% would say yes to that. 8 to 12% of people have a specific phobia. There are some gender differences in what those phobias tend to be. So women tend to be more likely to have phobias of things like animals. Men, for whatever reason, tend to have more phobias of like medical procedures, things like needles, surgery, etc. And for whatever reason, specific phobia is more common in the US than it is in a lot of other countries. Like in Europe, I think it's like 5% or less of people that have specific phobia. No clue what it is about our culture that contributes to that, but it's more common. Agoraphobia is maybe the most rare one, so only about 1% of people have agoraphobia. I think interestingly that one is higher in Europe. So in Europe, less likely to have a specific phobia, but more likely to have agoraphobia. Social anxiety disorder, 7%, and then panic disorder, there's a 2 to 3%, again, 12-month prevalence. In general, females are twice as likely to have any of the anxiety disorders listed. So there's that gender difference as well. And then for comorbidities, like I said, anxiety disorder is comorbid with a lot of other disorders. These are the most common ones. So for someone that has an anxiety disorder, they are also very likely to have another anxiety disorder. So a lot of people that have these diagnoses may have multiple. They might have a generalized anxiety disorder and a specific phobia, or a specific phobia and social anxiety disorder. So it's very common they're going to be diagnosed with multiples. Mood disorders are another common comorbidity. So remember, that would be things like major depressive disorder and bipolar disorder. Substance use disorder and post-traumatic stress disorder are the other most common comorbidities with anxiety disorder. But really, I think almost every disorder we talk about seems to be comorbid with anxiety disorder. And that might just be, if you have a psychological disorder, you're going to be anxious about a lot of stuff because that, is going to cause difficulty in lots of aspects of your life. So you're dealing with extra stressors. So that might be why.
I found this slide interesting because I have
That's, yeah.
PTSD, not, I've dealt with a lot of it, so not so bad, but,
Right.
I have generalized anxiety, I have bipolar.
Yeah.
And once you're diagnosed with a substance use disorder, no matter how long you've been
Yes.
clean, it's always there,
Yeah.
so I was like, wow.
Yeah.
Okay.
Yes, you're not alone. These, yeah, very common comorbidities to have all of those together. And I think, again, it makes sense. Like, if you struggle with any one of these, it's going to make life more difficult in a lot of ways that then causes other, symptoms that become enough that you could classify it as a disorder. So, okay, as far as causes. So one, I think every disorder we've talked about, there's some genetic component we know to these anxiety disorders. They do tend to run in families. Twins are more likely to share a common anxiety disorder. There also seems to be some abnormal neural anatomy. So as we were talking about earlier, so there's some evidence. If you remember, we talked about the HPA axis, I think when we were talking about PTSD maybe. So it's, the part of the brain and then the endocrine system that releases all the stress hormones. It's the way our body reacts to a stressful situation. And it's been shown that people with particularly panic disorders, but really any of the anxiety disorders, they have a hyperactive HPA axis and a hyperactive area of the brain that signals that. The amygdala as well. So the amygdala is a part of the brain that regulates and processes emotion. That also tends to be hyperactive in people that have these anxiety disorders. Yes.
I was watching the show the other night and it was saying that a lot of Native Americans, this genetic, because of the trauma and certain,
Right.
even that it mutates.
Yes.
And then it is passed on.
Yeah. So there's something called epigenetics, which is basically where, I can't remember if we talked about, I know we talked about this in my development class, and I can't remember if we talked about this at the very beginning of this class or not. But essentially, we commonly think our genes are kind of set when we're born, right? You're born, you have your genes, and they are whatever they are. But there's all kinds of environmental things that can actually impact your genes, that can either mutate the way that they reproduce, or it can turn on, not all of our genes are turned on all the time. They get turned on and turned off depending on different things. And yeah, there's studies with, not just with Native Americans, but I think with other, I can't remember the exact population, but there was some population that had experienced basically a genocide within their country, and the survivors of that went on to have these epigenetic effects where they passed on genes that basically controlled a lot of these things we're talking about and created more stress and anxiety in later generations.
Transylvania, that's where it was.
That sounds familiar, yeah.
Vlad,
Yeah.
what was he called? Vlad, he was in Europe or something.
Yes, yeah, it's been forever since I read about it, and I think there's multiple studies in different populations too, but I think that was one of them, yeah.
Yes, Vlad.
Yeah. Yes. So that might be part of the genetic contribution, is that the families and groups who have experienced trauma that affects their genes in a particular way, that then they pass on kind of that trauma response basically to later generations. All right, maladaptive assumptions have been shown to be another kind of factor that contributes to these anxieties. So it's basically people who have, constant kind of negative thoughts and that ruminate about the negativity of things. That's particularly true in things like social anxiety disorder. Someone who has that and is going into a social situation, they may spend a lot of time worrying about, what could possibly go wrong. Am I going to say something stupid? Am I going to trip? Am I going to do something that's embarrassing? And those maladaptive assumptions basically just, cycle and cycle and puts them in a state of worry. Conditioning is another one. So conditioning is where we associate one stimulus with another, particularly if something happens early in childhood, where there's a stimulus and then some sort of traumatic situation. And in this case, when I say traumatic, it doesn't really have to be huge, especially if you're a child. So let's say, for example, I don't know, let's say you're a kid and you go hiking on a trail with your parents and there's a cliff drop off that's pretty steep. And maybe as a kid you're totally fine with it, not scared at all. But then maybe your parents freak out and start screaming, hey, get away from the ledge, make a big deal out of it. Then you might associate that height with that reaction. and then that becomes kind of internalized to where now you're scared of heights, whereas you wouldn't have been if you hadn't experienced that situation. Modeling is kind of similar. If you see that someone else is scared of something, then you're likely to internalize that fear, again, especially if you're a young child. So if you see as a kid that your mom is terrified of spiders, then you might internalize that fear and carry that as well. And all of that kind of relates to sociocultural factors. So as a culture, we tend to decide that certain things are scary, even if they're really not. So if you think about it, things like spiders and snakes, a lot of people how many of you are scared of spiders or snakes? Okay, so most people, right? But if you think about it, like, have you ever heard of anyone dying from a spider bite or a snake bite, like that you know personally? I mean, it happens occasionally, but it's extremely, extremely rare. So the actual danger of a spider or a snake is pretty low. And yet we're not scared of things like cars, right? Even though one of the most common causes of death is car accidents. And that has to do with, the way that our societies and cultures have developed and evolved over time, and just kind of decided like spiders and snakes are scary, cars are not. So often these fears are very irrational, like I said, disproportionate to the actual threat or danger. Anything else I wanted to say about that? No. Okay, so we have some pretty effective both medical and therapeutic treatments for these anxiety disorders. Some of the medications that are commonly used, benzodiazepines used to be kind of the standard for anxiety disorders, but they have a lot of pretty serious side effects, so they're not prescribed as often anymore. So now often what you'll see, someone with anxiety disorder will get antidepressants, things like SSRIs and SNRIs. I didn't say it earlier, but one of the other potential causes, so when I was talking about genetics, one of the genes that's been shown to be common in people with anxiety disorders is a gene that affects our serotonin activity. So it's basically a gene that codes for like a serotonin transporter that helps helps the serotonin get out into the synapse. And that seems to be mutated in people with this anxiety disorder. It's like 5-HTA or something like that. Yeah, yes. And so it kind of makes sense then that drugs that target serotonin would help alleviate those symptoms of the anxiety disorder. So there are medications. Therapies also, though, are extremely effective in treating anxiety disorders. So a couple that are commonly used, rational emotive therapy is really a type of cognitive behavioral therapy. So I have both those listed, but they're kind of the same thing. So rational emotive therapy is basically training yourself to identify negative thought patterns and kind of shut them down before they get going and to replace them with more positive things. So if someone who has social anxiety disorder, if they know, oh, there's this party coming up in a week, I really want to go to it and try to make friends, but I'm going to look like an idiot, I barely know anybody, and they just have this negative thought pattern that starts going. Rational emotive therapy teaches them to identify that, stop it, and then replace it with something positive. Replace it with, no, this is going to be a fun experience, I'm going to get to meet new people, etc., etc. Exposure and desensitization is probably the most effective treatment for most of the phobias and things like agoraphobia, specific phobias, and social anxiety disorder. Exposure and desensitization basically involves exposing the person to the stimulus in kind of a gradual, stepped approach. So if someone has a severe phobia of spiders and they want to overcome that, you might start by just showing them pictures of spiders and maybe even try to find like the cutest one you can. There's a YouTube video of this spider named Lucas you guys can find if you have I love spiders, so just so you know. I know I'm a weirdo. But Lucas is this like really cute little fuzzy jumping spider. If you guys ever seen a jumping spider, they have like the fat chunky legs and they're like really fuzzy and they have big eyes that'll like look at people or whatever. So Lucas is this like Disney Pixar version of that. So you might start with that. Like, let's just show you this cute fuzzy video of a Disney Pixar spider, right? And if you can look at that, okay, maybe now I'll show you a picture of a black widow, right? Maybe that's a little scarier. Okay, you can handle that. Now maybe let's get a spider in a cage, like on the other side of the room, and like, can you be in that room? And then just gradually work your way up. Eventually you might have someone holding a tarantula in their hand, like totally fine with it. Yeah.
Now, is that considered like a phobia?
So I would say it's a phobia of a spider if you go out of your way to avoid it. Then yeah, probably.
Because I get like where I like want to vomit.
Right.
With spiders, like
Yeah.
I get really like, and I start sweating. And
Yeah.
I itch. So I don't
That
know.
might be considered a phobia. Yeah, specific phobias are fairly common. So yeah, you probably do have a phobia of spiders. Which a lot of phobias people are like, you know, it often does not interfere with daily life. So with almost everything in the DSM, we're like, it's got to interfere with daily life. It's got to interfere with your social life or your work or your school or whatever. Specific phobias often do not, unless, like, I don't know. I mean, especially because people go out of their way to avoid it. So, like, if you're terrified of heights, you're probably not going to get a job, like, working up on the telephone poles or whatever, right? So then, like, it's not going to matter in your day-to-day life if you're scared of heights because you just avoid it. And it's not that hard in most cases to avoid whatever we have a phobia of. But I think a lot of people, you know, want to get over those phobias because then you can go explore nature or you can hold a jumping spider. They're really cute. I promise. It's worth it. But yeah, what else? Is there, another, so some phobias are very easy, like in a clinical setting, to do that kind of exposure. Like I could, you know, easily go buy a tarantula, bring it into a clinical setting if I was a psychiatrist and I wanted to treat that. Some are a little harder. If you have someone who's scared of heights, right, you can't bring the Grand Canyon into your office and have someone experience that. But it's fairly common now for clinicians and psychiatrists to use virtual reality as an exposure method. So I don't know how many of you have ever interacted with like a VR headset, but they're very effective at basically immersing you in an environment and it feels very real. So, you know, heights is a good example. If you put on a VR headset and it's showing you that you're on a cliff, even though you know, like, this is not real, you get that sensation. It feels very much like you are at the edge of a cliff. And if you're scared of heights, it would be absolutely terrifying. So that's another kind of tool that's often used for exposure and desensitization, because then I can, like, put you in anything. I can put you in an airplane. I can put you in a social setting. I can put you in pretty much anything with a VR headset. Another treatment, this kind of a therapy of sorts, is called biofeedback. This is particularly effective probably for like panic attacks, but also any of like those physiological symptoms that come along with the anxiety disorders. So biofeedback would be basically putting any device on you that will measure your, you know, like your galvanic skin response, how much you're sweating, you know, that will measure your heart rate. There's like EEG caps that will measure your brain waves and things like that. So there's biofeedback therapies where basically you teach someone to monitor their physical body and to practice different methods to like get themselves to calm down. So if I'm having a panic attack, I have all those devices and it's showing maybe my heart rate is up and maybe my breathing is increased and maybe, you know, the EEG is showing brain waves going crazy in certain parts of my brain. Then I might be able to kind of, you know, use this in combination with the rational emotive therapy to talk myself out of that panic and then identify what works and what doesn't. So maybe there's a certain thought pattern that when I have that, it brings my heart rate down, it brings my breathing down, it calms, you know, the brain waves. So then I know, like, okay, that thought pattern works for me. And when you get that feedback and you can see it visibly, you can see all these, you know, graphs and things that are crazy starting to calm down, it really helps the person learn quickly like what will help them get out of those panic attacks or those other anxiety issues. So that's another therapy that's used often in combination with the psychotherapies. All right. Any questions about treating anxiety disorders or anxiety disorders in general, I guess? All right.